At Kadlec Clinic Plastic Surgery and Dermatology, I personally do full cutaneous or full skin checks at least once a year, I recommend. So I remove moles, I treat acne, I treat adult acne as well as teenage acne, all sorts of rashes, all sorts of hair disorders, fingernails disorders, and I also do small excisions of skin cancers all over the body. At Kadlec Clinic Plastic Surgery and Dermatology, we're different because we are all-inclusive. Whether it's coming in and having your full body every year, having all your skin looked at, having a mole removed, having a skin cancer assessed and removed, we're just able to meet all your needs all under one roof. And we all work together very synergistically. We're cohesive, whatever it is you need, we're able to provide that.
The first time that I saw Vicki, a dermatology nurse practitioner, I was going in for my annual whole body mole exam. I am from what we jokingly call the baby oil generation, and we call it that because there was no such thing as sunscreen. We would just slather on the baby oil and go outside and lay by the pool or stay at the beach, and I was born in Florida, and so I knew that I had had my share of sun. She found a small mole on the backside of my thigh, and it didn't really look bad, but when she looked at it under the magnifying glass, it had a little bit of color, and so she went ahead and removed it, and when the biopsy came back, it did show melanoma. Her being able to find that mole early made me not have to have chemo or radiation because they removed it and it had clear margins, and I think because she was so thorough that I got very lucky. I saw Dr. Fleming for the first time because I wanted to get some information on maybe having some Botox for in between my eyes. I kind of have an expressive forehead and I wanted to smooth out some of the wrinkles. He explained everything thoroughly when I talked to him initially, and then when I went back to have the procedure done, he made sure that I had no more questions, and I'm very pleased.
The cosmetic procedures that I perform involve facial cosmetic surgery such as facelifting or blepharoplasty or an eyelid surgery, abdominoplasty, breast augmentation, breast lift or breast reduction. To be a plastic surgeon, you must be board certified by the American Board of Plastic Surgery. Many different physicians out there claiming to be plastic surgeons, but only those that have board certification in plastic surgery have had the required prerequisite training to perform that specialty. We're very tuned into patient satisfaction in our clinic, and I get most of my cosmetic surgery from word of mouth. So either patients returning for another or different procedure, or their friends or family.
I was diagnosed with breast cancer 5 years ago, and I had a mastectomy. Every time I looked in the mirror, I felt so bad about the way I looked. All I could think of was, I need to do something. And the surgery that Dr. Fleming started with was lifting my right breast first. And the surgery went fine. He did a terrific job, and I was thrilled. Then when surgery was complete and I was healed, he had my breast reconstructed. Dr. Fleming and I made plans to have a face and neck lift. I'm sure glad I did because it turned out really good. He's my angel.
Wow, there's so many reasons why we are different at Kadlec, and personally different in dermatology. We meet not only the needs of dermatology, the physical needs, but also the emotional needs. Even in dermatology, we think it's one body system. It is the largest body system, but it encompasses so many issues. It's very visible. You can directly see the result of your treatment or the need for more treatment. But derm is very immediate gratification for both the patient and the provider, because all you want is to do what's best for that patient.
I'm an esthetician at Kadlec Clinic Plastic Surgery and Dermatology. An esthetician does facials, chemical peels, microdermabrasions, skincare regimens to help patients for at-home skincare. People they don't have to see a doctor or to come in and get a facial at the clinic. They can make an appointment at any time for that. You have your dermatology, your plastic surgery, and now you can come in for your skincare and facials. And it's just kind of nice to have everything all in one place. I get to get up, go to work every morning, and make people feel good all day long.
Everybody at Kadlec Clinic is so fun. They're just very kickback. They don't make you feel self-conscious about being in there. They're just a great bunch of people.